My name is Dr. Lakita Carter, and I'll be your professor for etiology, screening, and assessments of co-occurring disorders. Welcome. I posted a written introduction to myself in the classroom already, but I wanted to send you this video message so that you can put a face to the name and get to know me and this class a little better. I'm a licensed psychologist who specializes in clinical psychology. A clinical psychologist is someone who's trained to diagnose and treat mental health disorders. I'm a remote employee of the graduate school, and I currently live in Baltimore with my family. We are huge Ravens and Orioles fans, and we're really excited that Orioles season is underway and Ravens season is about to start at this time of year. My clinical interests are relationship issues, addictions, the supervision and training of counselors, women's issues, and sexual assault survivors. My professional buffet includes a little bit of practice, a lot of teaching, a little bit of research and consulting, and a dose of online course development. My research interests are the supervision and training of counselors, multicultural issues in treatment, and female rape survivors. I absolutely love doing what I'm doing and wouldn't change a thing. So I love this course. It's really quite a fascinating course for me. Of course, psychologists are interested in the normal brain as well as the abnormal brain, and this course taps into all of that. So we'll be talking about the abnormal brain throughout our course together, and we'll be going over how to diagnose and treat disorders as well as how to assess for dysfunction in a person appropriately. I will tell you that this course is not an easy one. So there are lots of little details to disorders. So it takes some persistence, some attention to detail, and some diligence to really sift through all of the information. And in fact, some disorders are only different because of the length of time that they present. Some are only different because of one small symptom. So it'll be important that you pay attention to those details. However, I know you can do this. I do want to leave you with a few pointers before I end this message. Number one, trust in the academic process. It's going to be easier said than done, but it will be helpful for you to remember that, particularly in this course, that you are learning, even though when it feels like you're not getting it, you are learning. Number two, be patient with yourself. Again, with this course, you're going to have some frustrating moments because some disorders can look very similar to others. So there's going to be a steep learning curve in this class. Don't worry if you're not getting things right away. Number three, even though we're in a virtual setting, we can still have a connection and we can still meet face to face. So I've posted a link on the dashboard that will give you my available times if you want to meet with me. Once you give me a time that works best for you, I'll send you a WebEx meeting request. And basically all that is the graduate school's professional video conferencing system. So consider it a professional Skype or FaceTime system. We're going to meet there and we can discuss any class or professional topics that you have. And lastly, don't simply use your professors or me for class content. Pick our brains about your future in the field of counseling or addictions and use us as very ample resources. I think that's all for now. I look forward to learning with and from you in our class.